How to stop heart palpitations? Management methods to stop heart palpitations may include relaxation techniques and exercise. However, people with frequent or severe symptoms may need medical treatment. Heart palpitations may feel like the heart is beating abnormally, beating too fast, irregular or skipping a beat, fluttering, pounding. Causes of heart palpitations range from certain lifestyle habits such as alcohol and drug intake to strenuous exercise. They are not typically cause for concern. However, an underlying medical condition may be responsible. Keep watching to learn more about how to relieve heart palpitations and when to speak with a doctor. Perform relaxation techniques. Stress can have many negative effects on a person's health and may induce palpitations or make them worse. Some people may find the following relaxation techniques helpful: meditating, deep breathing, journaling, practicing yoga, spending time outdoors, exercising, taking short breaks from work or school, using guided imagery which a person can access online. Reduce or eliminate stimulant intake. Heart palpitations may become noticeable after using a stimulant such as tobacco products, illegal drugs such as cocaine and amphetamines, some cold and cough medications, caffeinated beverages such as coffee, tea and soda, appetite suppressants, some mental health medications. However, not all stimulants will cause palpitations in everyone. Stimulate the vagus nerve. The vagus nerve connects the brain to the heart, and stimulating it may calm palpitations. An individual can stimulate the vagus nerve with vagal maneuvers, which include holding the breath and pushing down, as though having a bowel movement, Valsalva maneuver. Placing ice or a cold damp towel on the face for a few seconds, splashing cold water on the face, chanting Om, blowing through an occluded straw. Before trying any of these methods, a person should speak with a doctor who can advise on the most suitable techniques. Keep electrolytes balanced. Electrolytes are electrically charged molecules that are present throughout the body and help with multiple functions. For instance, they play a significant role in regulating the heart rate. Low electrolyte levels may be an indicator of heart disease and other conditions that may cause heart palpitations. A person should consider eating a well-balanced diet that is rich in nutrients, fruits and vegetables. This will provide appropriate electrolytes such as potassium, calcium and magnesium. That said, it is best for a person to speak with a doctor if they have certain medical conditions that require limited potassium intake, such as kidney disease. High levels of potassium may cause arrhythmias and heart palpitations. Some people may wish to attain these nutrients by taking supplements. However, an individual should consult a doctor before trying any supplements, particularly if they are also taking prescription medication. Stay hydrated. Dehydration can alter electrolyte levels and cause lower blood pressure, which may lead to heart palpitations. According to the National Institute of Diabetes and Digestive and Kidney Diseases, people should drink 6 to 8 ounce glasses of water per day. That said, the amount of water that experts recommend drinking throughout the day will vary among individuals depending on age, sex, and pregnancy status. Symptoms of dehydration include dark urine, increased heart rate, dry mouth, thirst, headaches, dizziness, dry skin. A person should consider drinking a full glass of water if they notice any of these symptoms. Avoid excessive alcohol use. Although drinking alcohol in moderation is not necessarily problematic, research indicates that even having 1.2 alcoholic drinks per day can increase the risk of developing atrial fibrillation. Heart palpitations are just one symptom of this condition. Exercise regularly. Exercise can improve overall cardiovascular health and help restore the heart's natural rhythm. It can also help reduce stress and anxiety. Cardiovascular exercise helps strengthen the heart, which can prevent or reduce palpitations. Beneficial forms of exercise include brisk walking, jogging, running, biking, swimming. However, exercise may trigger palpitations in some people, and it is important to identify and avoid potentially problematic types of exercise. Anyone who plans to begin a new exercise regimen should discuss their plans with a doctor first. Additional treatments. Treatment for heart palpitations will depend on the cause, including premature ventricular contractions, premature atrial complexes, supraventricular tachycardias, atrial fibrillation, atrial flutter. If there is no underlying medical condition, a doctor may seek to reassure an individual that the palpitations are not harmful. However, a doctor may prescribe appropriate medications to help control a person's palpitations and heart rate, such as beta blockers, calcium channel blockers, antiarrhythmic medications. If medications do not stop frequent palpitations, a doctor may suggest catheter ablation. This procedure involves inserting a thin tube through a blood vessel to the heart. Other possible treatments include surgery, a pacemaker, changing medications that may be causing palpitations. When to speak with a doctor. A person should consult a doctor if they are experiencing heart palpitations that tend to last longer than a few seconds. The doctor can determine whether an underlying condition is causing the palpitations, such as heart disease, thyroid issues, anxiety, structural or electrical heart conditions, an abnormal heart rhythm known as arrhythmia, significant anemia, heart failure in rare cases. Also, a person who has had a heart attack may be more likely to develop palpitations.